Cosmetics provides healing skin solutions for the entire family, including products to protect your baby from the effects of weather, wet diapers, and eczema. Everyone in our audience will take home a gentle hair and body wash and lotion. We're also going to drop this family care pack with a whole line of Skin Fix products, so use and enjoy. Our viewers send us questions all the time. I'm glad I have Marjorie and Karyn here to answer this one. This is from one viewer who says they love Cityline. My husband and I have been married for 9 years. I have a 4-year-old. We experienced infertility having our daughter and continue dealing with that, trying for another child. That, combined with the stress of moving countries, new jobs, new house, fewer friends, has created a lot of stress in our relationship. And I know we don't communicate well. Help. There's a lot going on in this family. So they're looking for some answers of how they might be able to de-stress, and dealing with infertility is a huge one with our viewers.
Yeah.
What do you think?
I can speak to the infertility. I mean, I see couples every day, and people deal with the stress of it differently. I have some people who just see it's par for the course. We know that it's 1 in 6 couples, and we're just part of the people who decided to have babies later. But it affects a relationship. Sex is supposed to be for fun, and it's not. And if anything, I see more of the like, so I need to do inseminations for you, and they'll say, oh, thank God, I don't have to have sex anymore.
Right.
So you wonder, no.
Because it's a scheduled thing, you feel like robots, right?
They end up feeling like robots. So, you know, for some people, it's not that anxiety provoking, and for other people it is. So in the office, we offer patients naturopathic consultations. They can have acupuncture, things to de-stress, yoga. We encourage a mind-body approach to it. Much as I'm Western trained physician, I do have to give people hormones, get them to ovulate, time sex, and inseminations, IVF, whatever. But the relations, I could use you in the office, because honestly,
I was going to say, do you have counselors in the office?
We do have counselors in the office, social workers that deal specifically with infertility, because it's such a multidisciplinary approach. But the relationship toil, regardless of what kind of relationship it is always there.
Do you have some advice for a family that might be dealing with all of that? I like the idea of going natural and holistically and taking advantage of whatever you can in terms of holistic health.
Yeah. So, I mean, Brett and I experienced infertility, and I will tell you, it has a toll on a marriage. And I think part of it is that there's so much built up anxiety, there's built up, you know, this dream that you have, and you're kind of waiting. And you just don't know. And I think the biggest thing is you have to talk it out. You've got to get all that emotion actually out. And I found that for myself is that if I was not kind of really processing the emotions, it would come out at him. Right? And so, for a lot of couples, I mean, when we see couples at our center, you know, whatever the stress is, whether it's infertility or job loss or whatever, you have to start learning how to go towards yourself, because here's the thing, stress does things to couples, and whatever direction you're going before that crisis is the direction that you're actually going to keep going. So if a couple is close before a crisis, they will get closer. But if a couple is already starting to become distant in a crisis, a lot of times they get further apart.
I totally see that.
So it's really, what you have to do is, I tell couples, you have to turn and you got to start talking about this. And I found that for us, and it's intense. And if you feel like you can't do it by yourself, then see a counselor. Really kind of get that help, because otherwise that emotional stress will affect physically. And then it becomes like a circular, right?
And there are also support groups, I should say. We have a support group that we're actually also starting for patients, so patients can come together and talk about it, because venting, being able to talk about it, sometimes with your spouse, sometimes not.
Right, but you have to get it out. You cannot keep it in.
Absolutely.
Good stuff.